afternoon, everyone. If you take a look at the screen behind me, you'll see what is known as the Universal Pain Scale. It's universal because pain is universal. As you can see, it goes from 0 to 10, with 0 being no pain at all, to 10 being pain so excruciating you're going to pass out. I don't know if any of you ever been in so much pain you passed out. To put it into perspective, let's think about when was the last time that you stubbed your toe? Seems trivial, but think about it. It hurts really, really bad. I don't know, where would you rate that on the pain scale? I personally would probably put it somewhere between a 6 and an 8. For those few minutes it lasts, it's pretty unbearable. Can you agree? Luckily, though, it is over quickly. Today I'm here to talk to you about chronic pain. Chronic pain is like having that stubbed toe feeling right there around a 6 or an 8, really excruciating pain, but it doesn't ever go away. I have had chronic pain since 2006, and it is a big problem for many people. It interferes with their ability to do the daily tasks of life, and the patients who have chronic pain really need options available to them to deal with it. What works for some people does not work for everyone. The most common way that doctors deal with chronic pain is with pain pills. As you can see, there are a host of side effects with pain pills. They try to give non-narcotic pain pills to people who have chronic issues because they don't want them to become addicted. But even Tramadol, as you see listed here, which is one of the more mild pain pills, has a lot of side effects. I personally was on it, couldn't keep food down for an entire year. Went from size 14 to a size 8. And unfortunately, they give you even more pills to deal with all the side effects of the first pills. Once you get up to 5 or 6 different prescriptions a month, a day that you have to take, you really start to feel like a pillhead. You're foggy, personally I was, and I couldn't function. I had surgery and was getting cortisone injections for a while from my orthopedic surgeon. The time came after about a year of that, they weren't doing any good, and my leg actually hurt worse afterwards. So I told him about this. I told him I didn't want the drugs and I wasn't going to take any more injections. And he said, pretty much, don't come back. You have no reason to see me. Go get some acupuncture or see a chiropractor. What I use is a TENS unit, and you can see it here on the right. It stands for Transcutaneous Electrical Nerve Stimulator. Yes, I electrically shock myself to confuse my nerves so that my brain doesn't realize I'm in pain. This is how I get through the day. This is how I am able to come to class. What about marijuana as a medicine? People laugh. People think people just want to get high. People think it's just an excuse to make pot legal. I'm here to tell you that it's not. Actually, if you look at WebMD, the alternative ways to deal with chronic pain, the second option listed is medical marijuana. And what it says is, setting aside the controversy, marijuana has been shown to have medical properties and can help with some types of chronic pain. They did a study in Canada not too long ago that proved this. The most common side effects that people reported were headaches, dry eyes, numbness, a cough, and a burning sensation in the area with the pain. So when we put it into perspective, is using marijuana really that different than popping pills? Is it really that much stranger than electrically shocking yourself or putting needles into your skin? I'm sure by now you all want to know how we can make this option available in Ohio. It's your lucky year. There are 2 ballot issues being proposed this year to put it on the ballot. The first one is called the Ohio Medical Cannabis Act of 2012. This ballot issue deals with giving adults the right to grow, purchase, and use marijuana to deal with chronic pain conditions, as well as other conditions like AIDS, but I'm here to talk about chronic pain. It enacts regulations for doctors writing prescriptions, and it enacts a commission to oversee the entirety of it all. The next measure that is trying to make it onto the ballot is called the Ohio Alternative Treatment Amendment. It's very similar to the Ohio Medical Cannabis Act. However, it puts limits on the amount of cannabis each patient could have. It limits it to 3.5 ounces of usable marijuana and 12 plants for them to grow so that they'll have more. According to this map from the Washingtonian, we can see that 16 states have already legalized marijuana for medical use. California legalized it way back in 1996, and Maine legalized it in 1999. Actually, in Ohio, it's even been decriminalized for certain reasons already. And to date, I have not heard any reports of reefer madness. So when you think about it, is it really so strange to see this old lady smelling a marijuana plant and this poor old guy having to pop pills? Is it really that much different? This one can be a little disturbing. This man is inhaling vaporized vapors from marijuana, and it looks a little weird, but when you compare it to putting electrodes on yourself or shoving needles into your skin, is it really that much different? I can imagine if marijuana were legal, not saying that it would work for me, but every option that a person in chronic pain has available to them is one step closer to a productive quality of life that that person may be able to live. I do dream of one day having one whole week where I can make every appointment I'm supposed to go to, where I can cook a meal every night for my children, where I can play with them when they ask me to. I can go to the store and get what I need, or even just enjoy myself by working out in my garden. Could marijuana be a drug that would help me? I don't know. I'm not allowed to try. So in recap, pain is very real. Stubbing your toe, really think about that feeling. And imagine having that feeling constantly, all the time. What wouldn't you do to get out of that kind of pain? I personally choose not to be addicted to narcotic pain pills, which leaves me with little options. But relief must be found. There are 2 ballot issues you probably will see people going around asking for your signature for in the next few months. According to the Columbus Dispatch, they've got to get 385,245 signatures, either one, to be on the ballot on November 6th of this year. So if you see someone come up to you, your initial reaction may have been in the past like, druggie. Please reconsider signing it. And if it does make it to the ballot in November, please vote in favor of medical marijuana. Thank you.